Welcome back, everyone, to the Monmouth Moms podcast. It has been a minute. Somehow the winter got away from me. I think the absolute awful winter that we've had is just
so bad.
Kind of had me. I've been working, but it's just been. I haven't been in my office a lot, and we have not had a chance to hop on the podcast. So I'm so excited to welcome my first guest of 2026 in March.
What an honor,
Jessica Sweeney, who is a friend, and our kids are friends. Mm-hmm. So we do know each other a little bit. Got to know each other. Over the last, year or so, right?
Mm-hmm.
So I'm so excited to have you on. It was really funny to learn that you are also in the same building as me. And I guess, were we in the parking lot? And I was like, wait, what are you doing here?
Exactly. Chance meeting in the parking lot. Yeah.
So you're the owner of Two River Pediatric Therapy.
Mm-hmm.
We're going to dive into a lot of what you do, the incredible resources that you offer families in our community. I'm going to ask you some just really important questions about services that you offer for children to help them grow, and all the therapies that you can offer, like I said, kids, and chat a little bit about my experience with my son when he was little too. So tell me, where are you from originally?
I'm from Lincroft, New Jersey.
Oh, yeah. Oh, my God. I knew that. That's right.
Funny.
Okay.
Yeah. So born and raised, and left to go to college.
Okay.
Stayed out for probably 10 or 15 years after graduate school and living in Hoboken for a little bit.
Where'd you go to school?
I went to Ithaca College in upstate New York, and then I went to graduate school in Albany, the College of St. Rose.
Okay.
Mm-hmm.
My aunt lives in Albany. Ithaca College, I feel like I had someone I went to school with went there. It's so cold.
Oh, so cold. But it's like a different kind of cold. You expect it to be cold there.
Okay.
Yeah. And it's a long winter there. Always snowing. But it's so much fun and such a beautiful, beautiful city.
Yeah. I've heard that. There. I've never been. Mm-hmm. It's not close to Albany, right? Ithaca's no, I didn't think so. Okay. Yeah. It's really up there.
Yeah.
New York is such an interesting state with so much, so many different areas, right?
Yes.
When you think about
completely. And Ithaca is right on the Finger Lake region. Mm-hmm. So there's so much to do there all the time. So it was a great spot to be in. We had great music always came in. There's the wineries right around there too.
Oh, wow.
And yeah.
That's
everything
so cool.
on the lake. It was really fun.
Okay.
Mm-hmm.
I'll have to, that's not near, I'm going to butcher it. There's a marathon that they do. It's called the Wine Glass, and it's corn. I don't know. I'll think of it. It might be in that area. But I was looking at it the other day.
Yeah.
I have a sister who also lives in the Saratoga Springs area, but that's not close to Ithaca either, is it?
Not Ithaca. It's closer to Albany.
Yeah. Mm-hmm. So you lived in Hoboken,
mm-hmm.
and then did you meet your husband there?
I did.
Okay.
Yep. So we met playing dodgeball.
Oh.
In an adult dodgeball league. It was so fun.
That's fun.
Yeah, it was.
And he lived in Hoboken too?
He did.
Okay.
Yeah.
So was he from the area too, or
He's not. He's from New York, but his job brought him down. He worked in the city.
Okay.
So it's kind of the poor man's Manhattan. We lived there for a while. And then once we started our family, we came back down here. So I've been here ever since.
Yeah.
Mm-hmm.
So what was your major in school?
Communication disorders. So I started in speech.
So you always had an interest in that?
Always.
Wow.
Yeah.
That's cool.
Yeah. It all started when I was in high school. I worked with, it was actually a community group. It was called, now it's Rally Caps, mm-hmm. but back then it was, the name is escaping me right now. But you worked with particular children who had disabilities and helped them play softball. And I played softball in high school. So I brought all my friends from softball over, and we all did it. And it was really a lot of fun. And then is when I really realized that I want to help children with different abilities.
Okay.
Mm-hmm.
Wow. So that's so interesting that you were interested in it and then pursued it in college, and like nothing really changed that path at all.
No.
Because I feel like so many, like either don't know what they want to do, or like they have an interest in a certain major, and then, kind of it shifts like in their 20s or whatever. So tell me, so were you working in speech post-college, like right away?
Yes.
Okay.
Yeah. So I graduated from college and I worked in Pennsylvania for a couple of years before I went back to get my master's.
Okay.
So it was an interesting kind of turn, I guess, that I worked with really young children when I was in Pennsylvania at Easter Seals. I don't know. It was kind of an interesting program where the kids would come in. It was sort of school-based, but not really.
Okay.
And we would provide services for them all day long.
Oh.
So, yeah, there were different rooms with different head teachers, they called them, but it wasn't necessarily a school. And we would go in and do group therapy. We would pull out the kids for individual therapy, but no child was older than 3.
Oh.
So I guess it was kind of like early intervention, but at a center. And that was great. I loved it. But I knew that there was something else that I needed or wanted. So I went back to graduate school and was introduced to so many different opportunities for learning and growing in different ways. And through that, I figured out that feeding was one of the main things that I wanted to work in and kind of develop my skills in. So once I finished with graduate school, I came back down to New Jersey and started working at Children's Specialized Hospital. And there I worked with traumatic brain injured patients.
Wow.
Which was the most amazing experience ever. And it was amazing because you got to be so close with the families and you had to help the families kind of adjust to who their new child is and how to help that child grow and develop.
Wow.
Yeah, it was amazing.
Probably very, gratifying when, you help a child make any bit of progress too in that circumstance.
Absolutely.
So were the specialties and services that you learned early on, did a lot of those services exist, or have you seen this I don't know if it's industry, this specialty like grow over the last 2 decades?
There's been a lot of change over the past few decades. Yeah, for sure. And more attention is paid to certain issues that weren't necessarily attended to as much back when I started. And those areas were the ones that I was really interested in back when it didn't really
exist as like a specialty or a service within a practice. So early on, did you, where did you see yourself like going in your career? Did you see yourself working for like a hospital system or a practice?
Yes.
Okay.
That's exactly where I was. And I loved it. But then once we started a family, I realized that I'm a kind of person, I put my whole heart into something. And if I can't, then, it's not a good spot for me anymore. And once I had children, it was really hard for me to be able to kind of work in the hospital situation where you needed to have a lot of extra, if you know what I mean.
Okay.
Like you needed to be very consoling to a lot of the families that were coming in. And it was hard for me to be able to do that and leave it at work and then go home to my family and be able to kind of do that as well. So I kind of backed away from the hospital setting and I tried a bunch of different things. Starting my own company was one. And then I was itinerant. I kind of went into families' homes. And I did work with the kids in their own home, which was great, but it's hard because you can't see as many kids that way because you're moving into people's homes and you have to travel in between and that sort of thing. So having my own spot now where people come to see me, it makes it easier because now we can kind of set the schedule and get more children seen in less time.
Yeah.
So, which is good.
So it reminds me of when my son was little and he was about 18 months. And like back then there was, I guess maybe there was Facebook like emerging like at the time, but it was more like college kids used it. There was like MySpace. There was no, so like finding resource, like I read What to Expect When You're Expecting. And then like the first year and like you would just like either ask your mom or the pediatrician or like a book, right? Like that was really where you got all your information. So I remember like reading that like certain milestones that like, your child should be hitting. And like at 18 months, they should really be like saying a word. I don't even know if that's true, but I remember like thinking that's like kind of what the book said. Right.
Right.
And he wasn't, right. Like he was not saying anything at all. So I had him I guess I brought it up to the pediatrician and they suggested like having him evaluated with the state, and being that I was, I was married to his dad at the time, but we were very young. So like a lot more resources. I wouldn't say that. I would say any resource that was available like through the state was, obviously more accessible to someone like me versus, someone with like a different income level. So we had someone come out and evaluate him, and he did qualify for like this program essentially that was a speech program. And they came like once a week. I think it was once a week. Yeah, I think it was once a week for like a year and a half. Okay.
Oh, wow.
And and I did not pay out of pocket for anything. And I remember she came to the house, which is kind of what you're describing. And Shane, my son, he does not mind me telling this story. I've talked to him about it.
Okay.
So he would sit there and she would come, not include me like in any of the therapy, but then I guess just like talk to me about like what they did in the session afterwards. He would literally sit there and just throw toys at her head like the entire time, and made zero progress. Zero progress.
Oh no.
He was so frustrated because he couldn't speak. So he was just like, we'd get angry, and throw things at her head. When he turned 3, he did not say a single word till he turned 3, not one. And then once he turned 3, that was it.
The floodgates opened.
They opened and that was it.
There it came.
And I will say, a lot of things. The road with him was long in terms of him once he got into school, I think, and I'm so excited to hear about like all the services that you offer, because I think, I advocated for him as much as I knew how to, right? At the time, it was a different time. There weren't as many resources accessible that, either the pediatrician didn't know about, or it just didn't exist, or I didn't know about. I didn't know what maybe a questions to ask. And as he progressed like into school, he was diagnosed with ADD, and which at the time there was now it's all ADHD. There was no ADD anymore. When he got into like 4th grade, I noticed like certain things that like perhaps like he had like really struggled with like being able to, when he was younger, like getting his hair cut. Like he really hated getting his hair cut. We'd have to like actually like hold him down to get his hair cut, and just like certain sensory things that I think like I didn't know what I didn't know. And I just thought like he was being difficult. Right. And now, fast forward to he'll be 22 years old and he's doing, amazingly well. And he's a great kid and, no issues. But I think that he would have had a lot less of a hard time in school and like managing his work had he been given like the resources that are available now to him. Right. So all the ABA therapies and like all the different things that I think were probably maybe not diagnosed and stuff like that. It was bigger than speech.
Sure.
And I just didn't, I just kind of thought like once he started speaking, okay, like he's fine. But, I think that like there was probably things that like, could have been flagged essentially if he had gone to someone like you. So, so that was my experience.
Sure.
And I think like, no matter where you are in motherhood and like what, that if you feel like something is wrong, like, to advocate for your child, but when you're a new mom, like you don't know what these therapies are and what you
Right.
right? What's out there and what,
Zero
what you can do.
Mhm.
So tell me like some of the services that you offer. I'm sure you hear a lot of these stories all the time, or at least like, you have
Sure.
moms that come to you and they're kind of like, I don't know what to do, but there's something not right here. So
Absolutely. And kind of to speak to your situation, in our practice right now, what we like to do for the young ones is we have more than one therapist in the room kind of assessing the whole child.
Okay.
So if your concern was speech, but then on the intake, the phone intake, we find out that, he has a little bit of sensory issues with certain times of his day or certain activities. He has a hard time kind of managing and that kind of thing. It would make a red flag go up in my head that, we need an OT in that evaluation as well.
Okay.
So it's kind of taking information that mom or dad or whoever is giving to me just on that initial phone call to set the stage for what could be a very important evaluation for that family.
Mm-hmm.
So we do offer OT, PT, speech, just general services, but then we also offer feeding therapy and orofacial myofunctional therapy. With my PT, I do a lot of treatment together with her for torticollis with the babies.
Okay.
Because a lot of times the babies who have torticollis also have a difficult time feeding. So we work in tandem with the mom for positioning, for stretching, for oral stim, for all the things that are necessary to kind of prepare that baby for successful feeding.
Right.
And then we also we work with the gamut. So we start at birth and we go all the way to 21.
Okay.
Yeah. And I even treat some adults too for orofacial myofunctional therapy. If one of my referral sources sends an adult my way, they know that primarily we're pediatric, but I'll also help adults only in that area.
So would that be like if someone like had a stutter or something where they like are trying to?
That would be only pediatric.
Okay,
so the
okay.
orofacial myofunctional therapy is more of tongue movement, breathing patterns, those kinds of things, which could help with stuttering, but it's not a direct stuttering treatment therapy, if that makes any sense.
Okay.
So a lot of orthodontists send adults my way.
Oh, okay. Yeah, I wanted to get to that about how you help or prevent, I guess, kids from not having to get the palate expander and stuff, like how that all works.
Yeah.
Okay. I'm so curious about that. But I want to ask my first question. So, related to speech therapy, what are the red flags for parents? Like, what are some benchmarks, some timelines where parents are saying like, oh, she's, I think there's like a narrative out there. You probably hear this all the time, like boys speak later. Is that true? And be like, what are the, when should you, have your child evaluated?
Sure. So for speech therapy, you want words to start coming at a year.
Okay.
You want them to, not a lot, just a few prime ones, mom, dad, those kinds of things. No. And if they're not using any of those by 14 or 15 months, that's when pediatricians tend to say it might be time for a little therapy. Now, if that comes in conjunction with feeding issues, where they have the sensory issues, because this is all connected. So your muscles that you use for speech are the same muscles you use for feeding. And oftentimes, if there's one issue, both are of issue, and we're able to kind of look at both when they come in for the therapy or for the initial evaluation.
Okay.
So there's that. When they're babies, you're looking for that. You're looking for them to be able to eat more than just soft foods. You want them to be able to kind of start moving into like around 2.5, really being able to chew.
Okay.
Okay. If they're not able to do that, then that's a problem.
And that's why they would need feeding therapy.
They would need help with that too.
Okay.
Yeah. For once they get a little bit older, you start getting into the language aspect of things. So you want them to have a longer MLU, mean length of utterance. So putting more words together in the right order, using pronouns and all of that sort of thing. So that happens as they grow and develop. The expectation gets higher and higher. So that's all kind of dependent on where they are. And a lot of times that's when school kind of comes in and says, we're having an issue with this particular thing. Can you take a look at it with this particular child? And we're able to do a language evaluation, help them kind of ramp up in whatever area it is that's hard for them. And then, they continue on at school as usual. So,
okay.
Yeah. And then for OT, there's a lot of milestones for them as well, like rolling, crawling, the early developmental movement. And if those, I was just talking about this at the new mom school this morning, in that if they are not crawling, even though it's not necessarily a milestone, there's an issue. You need to crawl before you can do any other movement activities, because it affects the vision. It affects the crossing over midline. It affects all of these different growth and development kind of milestones that you were talking about, but later. So if they're not doing the crawling now, later these things very well could be of issue.
So if a child goes from like they pulling themselves up to just walking, that there's actually like some things that they need to kind of fine tune.
Yes.
Interesting.
Yes.
Okay. Wow.
Very much so. Yes. And these are all the things that we figure out because we work with the child as a whole, not just, you have a speech issue, you have an OT issue, we like to sometimes, if they come in just for one particular, like if they come in for an OT evaluation, we're able to, I always go into the evals just to check and see how everything's going, talk to the parent a little bit to see if there's any other outlying issues that might be going on. And then if there are, then we can kind of take a quick look to see if it's something that we need to look further into, or just a watch. We'll put it on watch. And then the OT that's working with that child is able to kind of look for growth and development in that area as they're working.
Oh, that's so interesting. How many do you work with kids that like have ADHD as well? Like, does that integrate into the services too?
Yes.
Okay.
And what we're noticing more and more is the children who have ADHD and any attentional issue tend to also not be good sleepers. So we're having kind of an interesting
revelation
connection, with that information. And so we're doing a lot of work, and that kind of brings in the myofunctional part of things, because if your body isn't in full recovery sleep mode at night, then what happens is they didn't really recover from the day before, which then sends their sensory system into overload almost, which then prevents them from being able to attend, to be able to tolerate, to be able to modulate, all of these things that are very hard to do for little people and then growing into being an adult. So
I'm learning all of this even about myself because of the Aura Ring, because of the recovery.
Yes.
Index, right. When am I like, I every morning you're like reading familiar with the Aura Ring, how it works, but it's like you get like a recovery index like a score essentially. And usually like if it's low or certain things that are low, like I can't think straight like throughout the day. And it's just so interesting that it's so like all connected.
It's all connected
from how well you sleep. That is so interesting. So when you started the practice, you were going, to people's homes, and then what made you found a space, or how did it all kind of come to be?
I started the company when I was up in Hoboken.
Okay.
Yeah. And
you had the kids in Hoboken too?
No.
Oh, okay. Got it.
No.
Okay.
So I was able to kind of come and go whenever I needed to. And that was, we had a different name for it up there as well. So I went to people's homes, and people, it was just a word of mouth company. I didn't do any advertising, any of that sort of thing. But at least I kind of started to learn the ins and the outs of owning a company and how to do the billing and the paperwork and all of that sort of thing. So that when I did come down here, I met Christine, who was the co-owner of Two River Pediatric Therapy for the past 6 years.
Okay.
And, the two of us kind of built it from zero up to what it is now. And it was very scary because we started COVID year. We opened in October of 2019, and 2020 is when the world shut down pretty much. So we didn't know what we were going to do. We were kind of like, oh no. But what we were able to do is, because we were considered a medical facility, like medically based facility, we were able to open. So, we had shields, we had masks, we had hazmat suits, pretty much the whole 9 yards. We were covered head to toe, but we had people in, and not a lot of other places around here were able to do that. So we grew a lot when that happened. And it worked in our favor for sure. Then, over the years, we built our connections with local pediatricians and dentists and mom groups and all the things. And these people continue to send to us. And it's kind of amazing to see how things grow and who stays connected to you and why. So that why kind of shifted how we positioned the company and the services that we do provide. So oral facial myofunctional therapy is an amazing kind of treatment protocol that I use, and I'm certified in it and trained in many different courses around that to then be able to provide the service. So a lot of the local dentists and orthodontists and not so much pediatricians for that as much as, other things, but they all send their kids because we work on airway and we work on movement and we work on, keeping the body open and being able to breathe in a way that's functional and keeping your tongue in the right position while you're breathing, and all of these things that nobody really thinks about when they're doing it is what these children need to learn how to do.
So what would be like some symptoms that a child would be displaying that would even require like some of these services, or that like the dentist would pick up on?
Sure. So if the child has a mouth open posture, which, that's a big telltale sign. If the child is having issues with chewing and swallowing, if they're a thumb sucker, if they have issues with certain sounds in speech, a lot of times people just look at S's and Z's as the telltale, because if they're protruding their tongue, that kind of thing, it's a tongue thrust. But it's so much more than that. It's so important to look at the whole mouth as they're speaking in general, because what we're noticing is that it's not only the tongue position, it's the jaw position too. So if the child is sliding, which means there's a weakness somewhere, we have to address that. And you also have to address the tongue at the same time.
Interesting.
So, yeah.
Is this the same therapy that helps with the palate as well, or is that different?
Yes.
Oh, it is.
It's
okay.
the same.
All right.
Well, because if your tongue is not in correct rest position, which is gently suction to the roof of your mouth, like that, what happens is your palate starts to change shape. Because your tongue is not the opposing force of your tongue is not in the palate.
Okay.
So what happens is it starts to kind of become higher and more arched. So the shape of the mouth starts to change, which then changes the growth and development of your bottom jaw, which then changes the whole look. Like your teeth start crowding. There's not enough surface area on the gums for the teeth to grow in properly. And that's why palate expanders are important. We need those so that they can expand the palate to then fit all of the teeth as they're growing in.
Okay.
Yeah. And the interesting part about all of that is now there are different tools that I use that are starting to help. Now, this is not to say that orthodontics are not necessary. They absolutely are. But these tools are starting to help shape or change the direction of growth of the jaw so that this way, when the orthodontics begin, they're at a much better place than they were before.
That's so interesting.
Yeah.
Because like I'm learning a lot more about obviously like orthodontia. Like I had braces, but were palate expanders even a thing like when we were growing up?
Not as
they
much.
weren't. Yeah, but now like a lot of kids have it. If not, like I want to say like I don't know, many. My daughter's getting them actually next week.
Okay.
They explained to me like why she needs this, right? And like because of the way that her teeth are, and if she doesn't do the palate expander and then do something else, that her middle teeth are going to. Her front teeth are going to separate again, something along those lines. And I was like, what? Like blowing my mind because I don't know. Like I just, I'm always so fascinated by like how all of these services exist that like we just didn't even really know about or have like when we were growing up. So,
not at all.
But you're saying that like some of these therapies can even just prevent having to take this step of the expander, and that they start like at a head, even though they will likely require braces, right? In many instances. Okay.
Yeah.
Very cool.
Yeah. And sometimes if we get that tongue into good natural rest position, then, the opposing forces are there.
Okay.
And the palate starts growing and you see so many different changes. It's amazing.
That's interesting. So when my daughter was little, we always used to joke that like she sounded like she was from Brooklyn. Like she just did, like it was funny. The way she talked, she was like, completely different than how she is now. Yeah, the R's. And like, she just always like, I can't even describe it, but it was funny. But now I'm thinking like, that was probably some type of speech thing that she outgrew. But like, was that something that I guess maybe should have been or could have been corrected? Possibly.
Some of those sounds are developmental in nature, for sure. Like that R can be a developmentally later sound that comes in.
Okay.
So if it's still that way at 6, I would say, or even 5, I would say, yeah, you might want to have it looked at. But when they're little, it's not as much of a concern.
Do they still identify speech issues in schools?
They do.
They do.
Yes.
I haven't seen that at my daughter's school, but most schools.
Yes.
Okay.
So if they're identified as potentially having an issue in any school, the school itself is required to have someone come and take a look.
Okay.
I believe. So what happens like my daughter's school is a private school.
Mhm.
So they don't have a speech therapist working there.
Right.
They have someone from outside come in to take a look. I think it's called MOASC or something like that.
Okay.
Yeah. So if there is a big issue that's affecting their ability to participate in the class or affecting their ability to learn,
Mhm.
that's when the school kind of is required to have them looked at.
I see.
Yeah.
Okay.
Mhm.
And do you get many referrals from like the schools as well? Okay.
We do.
Yeah.
Yeah. Because school therapy is slightly different than a more medically based therapy.
Mhm.
And we would be considered a more medically based therapy because we work on the oral motor skills
Mhm.
and the feeding and the swallowing aspect of things. School is limited to what they're able to kind of work on in that setting. So once it becomes bigger than what they're able to work on at school, that's when we get the referrals.
Okay.
Mm-hmm.
I'm going to go back to kind of my experience with my son and the state programs. And I think it works a lot differently than it did back then.
Mm-hmm.
But what would you say to a parent that perhaps maybe was in the same situation as me, not finding that there was much progression with the therapy that they're currently getting,
Mm-hmm.
advocating for your child, if you're frustrated right now and kind of like not seeing any, like I said, any progression, what would be like the best course of action for a scenario like that?
Sure. A lot of times in early intervention, I'm assuming the state program that you were using, if a child is in their own home, sometimes it works in the favor of therapy where they have their own, toys, they have their own spaces, they're familiar with the space, and that could be a very positive thing.
Okay.
Some children do better if they are not in their own space. It all depends on how that particular child kind of manages with change, manages with their ability to kind of tolerate different people, those sorts of things.
Mm-hmm.
So if a child is having a hard time in my particular practice with a particular room, person, whatever it is,
Mm-hmm.
it's usually not that person that's the issue. It's something around that person. So what we like to do is we kind of have a session where either me or somebody else who works in that particular area goes into the room at the same time, distracts the child, sees if they can kind of get them into moving the way that they need to or doing whatever it is that the goal is for that session.
Yeah.
Using a different voice or a different activity or a different whatever it is that might just be that one little switch that child needed in order to kind of meet that goal.
Interesting.
Yeah. So, and we also have parents in on our sessions. Every parent is invited to come into the room for every session that we have.
Mm-hmm.
So they see exactly what's happening, why it's happening. We talk about the why all the time because if you don't have the why, then the parents don't buy into the whole process. And then it becomes you working with the child for a half hour or 45 minutes, and the treatment isn't carried over at home. We do a lot of neuromuscular reeducation, which is taking the particular activities that we're working on in our practice,
Mm-hmm.
and we kind of build it into a home program for the parents to bring home with them. So this way they can build it into their home routines.
Oh, yeah. That's so important.
So important.
Because like anything with, training or anything, right? Like anything that needs repetitive, right? Like functioning, you need to be able to kind of like use all of those behaviors like at home when you're not in the therapy session.
Yes.
That's so important. Okay. Tell me what it's been like as a as a mom and a mompreneur and a business owner, what are your favorite things about running your business and being able to do both?
Well, the whole reason why I started this is because I love A, working with children, and B, working with families.
Mm-hmm.
So the love of having a mom and their child come in with this particular issue and helping them solve that issue is very invigorating to me. And that's what kind
lights you up.
Yes, it really does.
I love that.
I love that.
Oh.
So, no matter what that issue is, that is always the focus of what happens during our sessions, even if that might not be what I see as the main thing that we need to work on. We'll work on what I'm thinking too, but it's always in conjunction with what the parent has as their main concern.
Okay.
Yeah. And you have to do it that way. Otherwise, the parent doesn't feel heard. The parent doesn't feel a part of the team.
Mm-hmm.
And that's what we're based on, is making sure that everyone has a place at the table and everyone is important in the therapy.
Yeah.
Mm-hmm.
And what about running the business, like as a mom, has this been, I mean, it obviously, all presents its challenges, but have you found that it's worked really well for your family dynamic, like being able to kind of, set in your own schedule perhaps, and also, have a fulfilling career in the same breath?
Sure. Absolutely. I started this thinking that I was only going to be in the office maybe 1 or 2 days a week, and I would have other therapists coming and this and that. But I enjoy it so much that that's not how it's turning out. Yeah.
Okay.
So I'm here a lot and I love being here. And I've kind of integrated my kids into some of what happens here, which makes them feel important and a part of what happens here as well. It's not easy.
Nope.
It's a lot of hours and it's a lot of sleep lost and all the things, but it's worth it because in the end, I'm helping other moms in ways that I needed help when I had my kids at the beginning, or when I first had my kids. And again, kind of like what we were talking about, the services weren't as prevalent as they are now. They weren't as talked about. They weren't as available, and now they are. And that's really why I continue doing it. I love helping other moms and children.
That's great. It's I can, obviously I'd really admire what you do, and I could never do it, but I completely relate to that feeling of like knowing what you're good at, right? Like knowing what your what your strengths are, and like going into each week and being able to tackle those, and like the opportunity to be able to like give like a gift to so many families, and being able to help them grow, and that's what drives you, which is so cool that you can do that, and also run your business and provide for your family at the same time is so cool.
Yeah. Thank you.
So what would you say to moms right now if they are, kind of navigating like the early stages of some type of symptom that we've talked about? Like, what would be the first step?
The first step, I would say, if they are referred to our office, call and we'll talk you through whatever issues you are presenting. If they haven't gotten a referral, would be to talk to the pediatrician about anything and everything that's of concern to you.
Okay.
Because what's happening now is I feel like doctors are hearing more, and it's not just a 15-minute check. They're asking questions. They want to know more about your child. They want to know how they're progressing, and they're more readily kind of making the referrals for the different treatments and therapies that the child might benefit from.
Okay.
Yeah. Also, take your child to the dentist early. That's a big, that's a big one, because what's happening a lot now is the dentists are able to kind of identify any sort of issue with the tongue, with the teeth,
like structurally.
Structures and muscles.
Yeah.
So, and that's what I love is the structure, function, and muscle. That's my thing. And if there are any issues with that, they're able to they're one of those early detectors that are very helpful in the whole process.
Okay. And so how early? Like 6 months?
Some bring as early as 6 months.
Okay.
A year usually is a good time to go, just to get them used to being in the seat, having someone look in their mouth and those kinds of things. And it's a great introduction, and it's an early intervention detector.
Okay. Don't they look for like tongue ties and stuff too? Is that something that you
Yes.
Okay. All right.
Yeah.
All right.
So if there is a concern with any functional use of the tongue or the lips or anything really in the oral structure, we can do an assessment for that to see. First, we would need to kind of look at the child as a whole, the whole mouth, see how it's functioning together.
Okay.
And then we break the movements apart to see if they can still use those structures and functions in isolation. And then we kind of move into the measurements. So we actually take measurements for data to send to whoever the provider would be if they do need releases. And then the doctor then has a full functional assessment where the areas of disorder are and where we would need to work, which is very important because some of these doctors do, and dentists do different types of frenectomies.
Okay.
So, and releases. So this way they know what would be most helpful to the child and where the release would need to kind of, where they might need to release a little bit more, or depending on, where their structure allows.
Okay. It's really fascinating information. I feel like I've learned so much today. It was like all so many good things to know, like little nuggets of information, right? Like to just kind of be able to keep and refer and share with other parents in our community. So
sure.
Thank you so much for coming on today, for sharing your story with us and sharing the amazing services and resources that you can offer families in our community. Can you tell everyone where they can find you?
Sure. I'm right here in Red Bank, New Jersey, in the same building as Kate.
Yeah.
Right on Broad Street.
In Red Bank, yeah. And is it Two River Pediatric Therapy.com?
Yes.
Yeah. Okay.
Yep.
And you're on Instagram too. So we'll share all the contact information in the notes here so you can find Jess and your team at right here in Red Bank, New Jersey. And if you're struggling with anything with your child, then feel free to reach out to her because she's amazing. And it's just great to get to know so many incredible women in our community who can help families and our moms just like us. So thank you.
Yes, thank you.
Thanks
I appreciate it.